from the station that's on your side. This is Channel 7 News. Good Morning Arkansas.
Many of you watching are familiar with cholesterol-lowering drugs, and you're probably aware they've gotten a bad rap. Well, Baptist Health cardiologist Dr. Scott Davis is here with some new research you might find pretty interesting.
How are you, man?
Dr. Davis, always great to see you.
Good to see you.
I love when you come on because we're talking about medical advances, new research, and it comes out quite often.
Right.
Yeah, and this is no different. We talked about these before.
So the cholesterol issue is always a when should I take a medicine, right? And so we've known for a long time that secondary prevention, we have a host of data that support, look, if you've got coronary disease, if you're in the club, you need to be on a cholesterol medicine. I mean, I can quote you chapter and verse, study after study. But more recently, we've addressed the question of primary prevention. I don't have it, and guess what? I don't want it. Mm-hmm. So then, is there benefit to statin therapy? There have been several trials now that have come out in the last 4 to 5 years that have been prompted a statement from the U.S. Preventive Task Force Service on cholesterol therapy as primary prevention. And it goes something like this. If you have at least one risk factor for coronary disease, you have high blood pressure, you're diabetic, you smoke, you got a family history, that starts to cast a pretty broad net.
Okay.
Then you should consider being on some type of cholesterol medicine. And that is a new position statement as far as U.S. Preventive Task Force Service to say, listen, as an individual, if you're the folks that benefit are between usually 40 to 75. That's kind of the sweet spot of where the biggest benefit is. But if you're in that age range and you've always kind of wondered, well, Dad had a heart attack at 49. Should I be on something else besides just an aspirin a day? Should I do something else for my cholesterol? The answer is you should really consider strongly having that conversation with your primary care doctor, with a cardiologist, with me, to really consider that, because now we've got data to support, yes, it does move the needle to impact your overall outcome, improve your mortality.
A lot of people have concerns, and that's why they're hesitant to take some of these. With the safety of medications, you listen to a commercial with a lot of these medications, and the side effects don't sound fun, and I know they're rare, but they have to list them. But I'm sure there are a lot of concerns you hear from patients.
Side effects are real, and we don't have the perfect bullet in any medicine, so we want to be sensitive to that. But this is what this task force publication is addressing, is that the benefit far outweighs any kind of side effect. So we fully acknowledge that, look, you want to pay attention to liver functions, you want to pay attention to people that develop myalgias, muscle aches on these medicines, but that number is so small relative to the overall benefit that you would get.
And you mentioned people who maybe have a family history. These are folks that should be considering it when they have really no control over. They're eating right, they're exercising, doing all the things. They're not smokers, but I mean, they don't have a lot of control.
And here's the thing: you can't change who your parents are, right? So your genetics are a real factor in this whole thing. And I tell people, you may have the commitment of a religious zealot and eat cardboard all your life, and you're still going to have an abnormal cholesterol profile. So that needs to be addressed. And so now we've got some firmer footing, instead of just intuitively saying, well, yeah, you ought to be on a cholesterol medicine. Now we've got more chapter and verse, some hardline data to refer to.
And do you think that the research, the built-up research over the years, is making this more and more of a certainty moving forward, so that where you can feel confident as a doctor, they can feel confident as a patient walking away?
Not to wade into the weeds too much on the science of it, but studying primary prevention takes a larger population of folks and a longer period of time. So the question is, well, why haven't we addressed this or answered this sooner? The answer is, it took a while to get this data, a robust set of data, to then look at it and get some meaningful, interpretation to say, we need to get you started on this.
Okay, if you feel like you are in that grouping, you can always contact your primary care physician, and then they can recommend you to a cardiologist. And of course, you can always go and see the fine folks at the Baptist Health Center. And the Baptist Health Helpline is on your screen. You can call them right there and request to be transferred to the cardiology clinic, and they will take care of you. If you want to set up an appointment, go meet with Dr. Davis and his staff. They'll be happy to help you out. As always, Dr. Davis, good to see you.
Happy Thanksgiving,
and happy Thanksgiving to you, too. We'll see you next time.
Okay.